name is Natalie Muhia. I am in my second year of fellowship training at Mulago National Referral Hospital in Kampala. I come from Kenya. I am training in plastic surgery, if I had already not mentioned, and I enjoy what I do. Coming from internship and then having a small work experience, coming into COSECSA was almost being thrown in the deep end, but you do have people who hold your hand, who help you paddle through. So it's really shaped and positively affected my training, positively affected me. There is no day, or from my very short experience, everything is a challenge. You go in knowing possible complications, and you have to know how to firefight when you get there. Every day you go in knowing you're going to do A, B, C, D. And the goodness with the fellowship program is that you can always call someone. Someone is around, someone is there for you. So you're not alone. And that really helps and shapes who you become as a surgeon. So it's, what can I say? I can't point out one, but yes. How did I overcome it? With the help, yes. It helps to be hands-on, but it also forces you to have a lot of discipline to, go back to your books and actually read and have an intimate interaction with your books, because you will not necessarily be spoon-fed the theoretical part of it. It will come up depending on what exactly you're studying and what you're talking about if you're discussing a case, but it does help when you're in the operating theater and being guided through and you're working with your hands. So you're not checked out from it, you're present at all times. So it helps me personally, because I feel like I am in the procedure and I'm also learning from it. So for me, when it comes to collaboration in COSECSA, it's just abundance in terms of blessings, because I've gotten to know so many people and so many opportunities have been presented to me, which had I not been in COSECSA, I probably would have not had such an opportunity. So I can only tell you what I can only imagine what's to come, but the track record so far, it's beautiful, and I'm really grateful for that. As a surgeon, it's important for you to give back to the community. You've tried something out or you've noticed something out. It's important to take it upon yourself to study it and grow from it and help others grow, because the information I have, it's not mine. Someone has shared it with me. I've read papers people have shared. So what can I do to give back? And probably that would be research. The first mentor, he's Dr. Peter Odor. He's a consultant plastic and reconstructive surgeon based at Nakuru Level 5 Hospital in Kenya, because he noticed that there was an interest and he cultivated it, and made sure that I got into a fellowship program, even when at that time it was not possible in Kenya, but he did make sure that I got into a program. And then thereafter, Dr. Rosa Lenyo took the mantle over. So being a woman in surgery is it's something important. It's important to mention, because representation helps mold young minds, seeing that I can do what she's doing, and look at her. So I think it's representation will always be important. And for me, because at a young age of, rather when I was in undergraduate, I did see a woman in surgery and I was like, wow, okay, maybe I'll do that. Being associated with COSECSA, and God willing, when I finish, there'll be EXA, after my name. Everyone will ask, so where did you do your training? What was it like? And that brings up opportunities for others, but at the same time, you're being a good representative of COSECSA. And because people associate you with COSECSA, and if you're good at what you do, then they will give back, and you may get a training opportunity, you may get an opportunity to supervise examinations. During workshops, they may call on you to facilitate. So I think it does build your career, because you will grow. I don't see a situation where you're done and that's it. You'll always have a tie to them, always. People make the most out of what they have. Not all resources are, equal. Not everyone has the same, but does it mean that they are not operating? No. Does it mean that they are not giving the best care that they can? No. Once we are out there, we are going to impact health positively and make just even a millimeter of change, which if everyone does that, then that's, great. I'm proud of, COSECSA. I'm happy that, 25 years, I'm sure it's not been easy. There's still growing pains, still a long way to go, but I'm happy to be associated with COSECSA any day, all day, every day, and I wish them many more years. Happy 25 years.